They are so common and affect so many patients that it is practically impossible not to talk about them. Therefore, we have prepared this video to help you understand how to treat rotator cuff injury. What is the rotator cuff? The rotator cuff is a set of 4 tendons that surround the shoulder. These tendons help keep the shoulder in place and contribute to joint movement, each of which moves the shoulder differently. The injuries are pretty different from each other because they can be partial or complete. They can affect only one tendon or an association of them. The tendon may remain in its original place, or it may retract. The tendon and the muscle that makes up the tendon may be normal or worn out. They can be isolated or associated with other shoulder problems. Each rotator cuff tendon is forced into a particular movement. Thus, identifying the specific activity causing the pain will help the doctor determine which tendon is most likely to be affected by the injury. Symptoms vary according to the characteristics of the lesion. Still, they should draw attention to a rotator cuff tear, pain in the shoulder and arm region, which may radiate to the neck or scapula. More intense pain at night, when lying down or during sleep, often waking the patient up. Difficulty moving the shoulder, significantly when raising the arm above the head. How to treat rotator cuff injury? There are 2 ways to treat rotator cuff injuries, surgically and without surgery. The treatment is chosen depending on some damage factors and the patient. Here is a list of the essential characteristics. Patient's age. Patient's physical requirements. Other illnesses like blood pressure, diabetes, and heart problems. The severity of the injury. Pain intensity. Type of rotator cuff. Muscle degeneration intensity. Prevention of rotator cuff injury. Individuals who want to prevent rotator cuff injuries must work with specific exercises to stabilize the shoulder. Must strengthen the cuff muscles, especially with athletes. Our last tip for achieving effective rotator cuff injury prevention is to be careful with the load. The elastic band is an excellent option to avoid overloading and impacting the shoulder joints, but starting with low loads is still essential and progressing slowly. You now have basic knowledge on preventing and treating rotator cuff injury. Stay safe.